Sometimes you need to get your anterior front teeth replaced even if they've had previous crowns on it, and I love this example here. They're going to show you how they're replacing some crowns and putting some other crowns. They call them veneers, but they're really more like crowns on these teeth. So right now they're cracking off the old ones. You can see that there's these lines on the top of them where you could actually see where the tooth and the crown came together. Underneath those crowns, look, it looks pretty bad. There may have been some decay underneath those crowns, so not only were they not sealed potentially properly, but there may have been some recurrent decay that went underneath those crowns. So this guy is trying to, guy or gal, the dentist, is trying to clean it all up, make it look as good as they possibly can. You can still see the two front teeth are slightly kind of darkish, but they must have felt that it was strong enough to put the crowns on them. So now they're going to take this impression with that purple stuff. They're getting every little detail of that preparation to make sure that they can give an outstanding crown at the end of this. So this this impression is going in there. They're going to bite on it to make sure that it comes out really good. You're going to see in a second the impression looks great. You can see the margins of the teeth. Now they're going to put in the temporary. The temporary itself actually looks pretty darn good. Like, that's not bad. And now, this is not that same day, this is going to be a later time, they're going to start to prepare the teeth so that they can actually put the final crowns on there. You can tell the temporary was one unit all together. These final ones will definitely not be that. So the isolation here is a little different, maybe a little different than we would do, but the final result is going to look great, and that's why I chose this video. So at our office, we would isolate slightly differently, but the result here is great. So they're putting on the crowns. They're using a special instrument to put on those crowns. So that it doesn't fall into the patient's mouth, which is important. You can see all this stuff oozing out. That is just the glue that we use to cement these crowns on those teeth. So that blue thing cements or hardens the glue to make it look nice and pretty. And they're flossing through to make sure those crowns aren't stuck together. No cement material got stuck in between the teeth, so it looks nice and good. And look at those results. The before and after. Amazing. So that's why if you have these crowns where you can start to see the margin, you can start to see the metal or anything starting to show through, sometimes it's a great option to get those things replaced. Say you've had those crowns for 10, 20, 30 years, whatever it is, it's nice to get those replaced because technology has changed and crowns have gotten so much prettier. In this example and other examples, the crowns look so good. I'd rather have those than natural teeth. Now, I'm not saying you want to get those instead of natural teeth, but man, sometimes those crowns and veneers look better, honestly, than natural teeth. And this dentist did an outstanding job of making it look as aesthetic as possible. Even when the underlying tooth structure was not quite as perfect as possible, the results were great. So once again, Dr. Nate here at Thrive Dental and Orthodontics. And if you need any help with your crowns or veneers, let me know. If you've had crowns or veneers, especially on those front teeth, I want to know about it. How did it go? What does the result look like? Were you happy with it? Were you not happy with it? I want to know, so please leave your questions and comments below, and I'll see you guys in the next video.